Good afternoon, everyone, and welcome to our North Country Telehealth Partnership Telehealth Learning Collaborative for July. My name is Nancy Del Mastro. I'm the Telehealth Project Manager for Adirondack Health Institute, alongside my partners from Fort Drum Regional Planning Organization. We're happy to have you here. As usual, we'll start with just a couple of quick regulatory updates before jumping into our featured presentation for this month. And after that, we'll leave some time for Q&A and then any other updates or information to share via the chat. So we'll go right into some quick policy updates. On behalf of New York State Department of Health, just have a quick item to share from Kate Bliss. We did mention back in May that a new telehealth policy manual was published online, and we did circulate that back in May. There haven't been any updates to that, so that is still an accurate version that we did share at our last meeting, but it was recently included in a new Medicaid update that was circulated via email. So I'll have both that Medicaid update and the telehealth policy manual included in the chat right after I'm finished speaking, as well as in the notes document. And that's a really great comprehensive document about Medicaid telehealth usage for our providers within New York State. I do not have any updates on behalf of the Office of Mental Health or the Office of Addiction Services and Supports, but I'll also include the most up-to-date policy guidance from those two agencies with our notes document as well, in case anyone is looking to reference those easily. And then the only update I have on behalf of the Center for Medicaid and Medicare Services is that last week, the calendar year 2025 Medicare physician fee schedule proposed rules were released. And this is, again, just the proposed rules. The final rules don't come out. They're not published until September. But the proposed items do include quite a few that are related to telehealth flexibilities for Medicare. So I have the press release that will be included in the notes. I'll pop that in the chat. And our partners over at CTEL also created a really nice summary of the key telehealth provisions that are included in the proposed ruling. That really is comprehensive and specific to telemedicine and telehealth and telecommunications. So that will be popped into the chat and included in the notes as well. And we'll be looking forward to talking about the final rules at an upcoming meeting. And we'll be sure to circulate any other updates that we see come through coming up as well. So again, you'll see the telehealth provider manual from New York State Department of Health Medicaid, and then the physician fee schedule proposed 2025 Medicare rules coming through in the chat and in the notes. And that's all I have in terms of policy and regulatory updates. So without further ado, I will turn it over to the Mobile Beacon team, which is Brian and Tom, and the TechSoup team, which is Joe, to talk a little bit about digital equity and access specific to healthcare, but also digital equity in general, which we're really excited to hear about. So I'll turn it over to the team now. Thank you so much.
Great. Hello, everybody. My name is Brian Miller. Let me know you can hear me. And as I advance my slides, I see Nancy thumbs up, so we're good to go. My name is Brian Miller with Mobile Beacon. As Nancy mentioned, Tom, myself, and Joe are here, and we'll talk about strategies to expand digital equity and access. First, just want to touch upon who we are as team members. So my name is Brian Miller. I've got about 25 years in healthcare and healthcare development experience. I spent 10 years assisting folks through healthcare reform, and I apologize for that, proactively through EMR record standardization, quality reporting, and also connecting with health information exchange efforts locally and nationally in Rhode Island. I bring partnerships, project management, leadership skills to Mobile Beacon to support this work in digital quality efforts. And as we know, when we think about social determinants of health and all of the ways that we deliver healthcare, this digital equity work overlays in that. So that's my play here. A little bit about me is I'm a nature guy, so I love to take a hike. I am a healthy person who has recently found the joys of cooking clean meals. So I love doing that. Love going for a bike and taking a hike on an area trail or even nationally. So Tom, why don't you tell us about yourself if you can?
Sure. Thanks, Brian, and hello, everyone. So my name is Tom Toepfer. I work with the Mobile Beacon as well with Brian. I have about 20 years of telecom experience where I've worked all over the East Coast on a multitude of different projects and carriers. And in the last 5 years or so with the pandemic, I really got a look into how bad digital equity was in our communities. I come from an area where my mom still lives in the house that I grew up in, and she doesn't have internet access other than a satellite service that she pays for. So that's true to my heart. And I spent a lot of time with the ACP program. And then I came across Mobile Beacon last fall, and it was a perfect fit for me. So like Brian, I too love the outdoors. I snowboard, I fish, I kayak, and I hike as well.
Tom does the more dangerous sports. We'll just put it that way. So now, hey Joe, why don't we hear a little bit about you, please?
Of course. Hi, everybody. My name is Joseph Garcia, and I work with TechSoup. I am a program manager at TechSoup, and I've been with them for the past 10 years. Currently, I'm overseeing a couple of our key programs, including the Ring program, the Mobile Beacon program, and our two Amazon programs, and also our Meta program. All exciting offers, whether it's donated or discounted offerings to the nonprofit sector. That's sort of what I help manage, and I help just maintain the programs and make sure that the product is getting to the right audience. Outside of work, I enjoy music in the park, art, fashion, and I have a 3-year-old Chihuahua named Yoli who's still in bed, but she'll be up soon.
Okay, so folks on the line, if you haven't heard about TechSoup and how they support community health and bringing access and services to nonprofit organizations, check out TechSoup afterwards. They're one of our core partner organizations, and they really do amazing work. So that's why the TechSoup group is here with us as a partner. So Tom, if you can kind of talk a little bit about Mobile Beacon, that'll be great.
Sure. So if you're wondering who Mobile Beacon is, we're a national nonprofit. We're based out of Johnstown, Rhode Island. Our core mission is really focused around the bridging the digital divide. But a secondary mission, it really is if we provide low cost, unlimited mobile broadband solutions. So if a nonprofit or community-based organization, healthcare, school, library, if they can save money through any of our solutions that we provide, that's also near and dear to our heart because they're going to take that money and use it to do something else, another project or another program that will help benefit their community. So that's a little bit about us.
Great. And you can see we love being together. There's a picture of us at a recent outing. So we get together often and do community building and local team building efforts. So a little bit more about our history and impact. We are founded by the North American Catholic Educational Program Founding, or what we call NACEF. That's a 501c3 organization. That's the second largest national educational broadband provider in the US. We're relatively around the corner from you guys, just down the street in Rhode Island. We are a natural extension of that. So this broadband solution set that we are doing and helping organizations, keeping it nonprofit to support other organizations' mission for access to service and building community. We are an extension of that EBS. And we leverage that broadband solution to bring those efforts to Americans around the country. We're B2B. We were founded in 2010, and we've helped thousands, if not even greater, community anchor institutions from nonprofits, healthcare, schools, and libraries gain access to internet services. So our solutions here, Tom, I'll let you take this one here.
All right. So yes, like Brian mentioned, we've been around since 2010. We've helped well over 1,500 nonprofits, 2,500 libraries. I think we have 1,700 right now currently that we work with. 2,500 schools and educational organizations. The cool thing about our education side of things, we can also work with teachers and be able to provide them access to the internet for their own personal professional use. And Brian actually was the one that kind of spearheaded our healthcare. We started that this year. We currently have 170 plus organizations from the healthcare side of things.
Correct. So as Tom mentioned, as in my experience as healthcare reform kind of stabilized and became parts of everybody's daily work, and that the transformational work kind of died down, digital equity ramped up. So the organization plugged in for healthcare organizations, of course, through the pandemic. Unfortunately, telehealth became a required component of the work. So recognizing that and connecting broadband, the natural extension here, made sense. So that's how we are connecting into telehealth. So for those solutions, we've donated about 150,000 devices, those hotspots there, and then over $9.2 million worth of donated equipment to support anchors, and over 2 million Americans. So when you kind of boil the work down and talking about how we're helping these communities get access to services through telehealth, through mobile patient monitoring, through educational systems, healthcare efforts, these are the bottom line numbers of things that we've done and helped. So Tom, can you talk a little bit about our network here?
Sure. So we're on the nationwide T-Mobile network. They lay claim to the fastest 5G network. They spend a lot of money investing in their infrastructure. A few years ago, they merged with Sprint, which kind of doubled their spectrum holdings and really set them going forward with 5G. And they're constantly adding towers as we speak. And like I said, the nuts and bolts of our service is only $10 a month, $120 a year for completely unlimited broadband through that 5G or 4G network. And we also have coverage in all 50 states, including Puerto Rico as well.
There we go. So a critical thing to recognize is for folks at the borders, right now it's not in Mexico or Canada, but we are US coverage. We have it in all 50 states and the 2 territories. So in Upper New York, I wanted to think about this and kind of give you guys a coverage map. This is through T-Mobile. So this is the map that they're looking at in your 9-county area. If you look a little bit closer, you can see the darkest color fuchsia there is the highest capacity network, and it goes down from there. The partner network, so there's really extensive coverage there. When you look at the mountains, sometimes in the chorus, the highest part of the mountains, there can be limited coverage, but largely there's pretty decent coverage through T-Mobile there. Tom, any thoughts on that? I know you're the tech guy on our side, so how do you feel about the coverage through here?
So obviously, where the old joke when I got started in telecommunication is that what I was always told to me is if there's more cows than people, more than likely you're not going to have a tower there because cows don't buy cell phones. So with that being said, the infrastructure has been growing out steadily since I started 20 years ago. And they're definitely investing more money into putting up towers to support further away. That part of the merger that happened with Sprint in 2020. I think it ended in 2020. T-Mobile had to invest to be able to get that merger to go through into more rural areas. So we're seeing more and more towers and spectrum to cover parts of that haven't been touched before. So if you don't see it now, I would say probably within 5 years from now, you'll start to see coverage hit some of the furthest spots that you never would get cell phone coverage. So some good things are coming, especially too with this 5G. You'll be able to get basically the equivalent to your Comcast or your cable provider speeds.
To support Tom in this statement, we are also finding, even in the past 6 months, that T-Mobile has released, I think it was 3 major press releases indicating that they've updated thousands of towers to 5G network and expanded 5G access across the country. So we actually see that strategic initiative being played out, that's good.
And they bought US Cellular as well. So they'll be taking over those towers, which doesn't really dip into upstate New York, but they do have some in kind of the upper Vermont, New Hampshire, and Maine. So, but all good things, sort of signs that they are taking the network coverage serious.
Yeah. I wanted to share a few folks that are in your general area who have access right now and who are using our services. So you can see a lot of libraries and churches. This is one of the places where we don't have a lot of healthcare efforts connected. So as you think about these and your work in the healthcare world, we'll talk about how healthcare uses broadband, as you guys, I'm sure you already know, but think about your organizations and how you can support your teams and your facilities and your patients. So one of the things I wanted to mention is this is proven messaging that we've learned. We surveyed organizations that have used us and to understand how they've actually reappropriated those expenses. They repurpose their funds. A lot of them hire more staff. They secure a backup option, so getting the battery-powered broadband. They create new programs with this, especially for medium-sized organizations who can save significant dollars, and they expand their existing programs. A lot of people save up to 80% by adopting these solutions because of that $10 a month versus 100, let's say, or 70 or 80. So it's an extensive savings per device that you're getting there. And of course, for members of the community that don't have access now, you're able to give them access. We're able to support your remote workers so that they can have access. What we do, so Tom, I'll let you take this. This one is about education in the education world, and this was the St. Patrick's Academy effort that we have live.
Yeah, so not only do we provide really cool mobile broadband hotspots, routers, and tablets, we also, since we're a nonprofit, have purchased a area of land here locally in Rhode Island, and are creating a farm that will focus a lot on education and culinary schools and donating the food that comes from that to food pantries. So it's another way we help our community. And during that build out, they were able to bring in a local school to kind of come in and do a like an archaeological dig to find things, and found some really cool stuff on the property. Dating back quite far. In New England, we have a lot, as you all know, we have a lot of great history. So if you spend the time looking under the earth, you can find some pretty neat things.
So as you think about it, for the folks on this call, what these students did is they had hotspots and they were able to roam our property and record the information that they found live as it was happening. If you connect that to, of course, your telehealth work, being out in the field recording patient information, it's a access that's kind of unprecedented. And there's a nice little quote that came from the organization. Okay. Tom, a little bit more about the educational piece.
All right. So when you wonder how can Mobile Beacon and our products assist education, these are the kind of the core focuses that a lot of people find in use of our hotspots and tablets and whatnot. So they can provide students who don't have internet. That's our key focus, is being able to get access to the kids who don't have access at home, be it through whatever means necessary. A lot of times the schools can fund it themselves and be able to get those hotspots or tablets into the hands of those kids. We also meet the Common Core standards for broadband. So in case a school that doesn't have access, they can use our service to be able to hit that Common Core standard. Also, too, we talk about facility support, or maybe you have a bus barn that may have cameras that need to be connected. That's where we come in too. It's a low cost, $120 for the year, $10 for the month. You can have that backup plan or facility support for maybe you don't have access. And then obviously for teachers and staff, you can take these hotspots home for your own personal or professional use. A lot of staff members in the education are usually continuing education. So they're doing a lot of studies in and outside of the classroom on their own. And this gives them kind of unlimited access as long as they have a cell phone connection.
Great. Yep. And then in the library space.
Sure. Again, similar. What do we do? How do we help libraries? Libraries have been our bread and butter since 2010. They provide a very great service to their communities where they can provide a hotspot lending program, and just like signing out a book, and somebody can get a hotspot for a certain period of time. They can have access to the internet, so people just kind of keep renewing it. And that's a really where we're able to hit a lot of communities who don't have access and provide a lot of help. And Joe at TechSoup has helped a lot of libraries with some of the programs that he'll go over later. But also, what else how can we help libraries? Again, facility support, staffing support, backup internet programs, and if you have like a bookmobile or some other type of outreach option, this is a really good way to keep your staff. And if you have a bookmobile, you're also community connected while they're out enjoying the nice weather. It's this time of year. You can be at a park, and anybody near the bookmobile could have internet access.
The nice 95-degree weather, Tom. So I'll tell you, for the healthcare folks on the line, again, in my social determinants world, seeing that overlay, I find libraries connecting with senior centers, adult daycare, and being this kind of meshed network solution. So understanding that in senior center world, in adult care world, libraries are also lenders, or they will connect with libraries, or the library will connect to the senior center to lend things out. So those are the places right there, adult education programs. So those are the places in which, to me, this overlays and supporting communities getting access. One of the things too, as I think through this, Tom, I'll let you talk about this one here. This one is the history with libraries.
Yeah, so the library lending program at this point in time is pretty ubiquitous, but at some point it didn't exist. And back in 2012, we were one of the first organizations that kind of spearheaded this program with libraries, because they were finding that, as we all know, libraries are a great resource in your community for things, books and education and knowledge, but also for computers and printing and different things. But the Wi-Fi hotspots just naturally became a staple. We helped create that program with the local community, with Providence Community Library, and now the patrons were able to access a hotspot to be able to take home and then get internet access if they didn't have it at home. So it was a really great program, and now that's exploded. Like I said, we've got over 1,700 libraries nationally, and in New York, the city of New York, we've got 130. And there's a nice little blurb there about the program and how it started.
One of the things that's important to me about libraries and this work also is they were the pilot for us of the internet lending program. So as I looked at health centers and community action programs, in that world, in a lot of cases, it can be a situation of there may be line running to the member's house, and it's accessible, but it's actually an affordability challenge. So these organizations in supporting the community have driven this betterment by creating these lending programs, which is what the library does. So finding that these healthcare organizations, these health centers, community action programs, senior centers, and libraries are in their lending programs have gotten folks access to broadband. So in the world of healthcare, this is really a big piece of getting folks connected to organizations. We're a dedicated partner in healthcare, as we've mentioned. So 170 organizations in the past year. I built that program for Mobile Beacon here, and we are channeling Native Nation, rural health, community centers, this digital equity work as our partners in what we're doing. The goal, again, as Tom mentioned, this is a $10 a month 5G unlimited service as our partner with our partners through T-Mobile. So that really allows organizations, especially small and mid-sized organizations, to spend less, get that full-on access, and focus on treatment. So in the ways in which we help through healthcare is patient telehealth, facility connectivity, remote patient monitoring, and then remote employee connectivity. You guys are telehealth experts, so I'm sure you already connect those, understanding we're a resource to help those things. One of the quotes I loved was this one that we have here. We love Mobile Beacon. Our nurses are working out in the community to help low-income individuals and families who do not have access to quality healthcare because they do not have insurance get the healthcare they need. The wireless services have helped them keeping good record of their clients they're helping with. This makes their work a lot easier. That was Emily at Deaconess Family Health Nurse Ministry. So again, nursing teams. And when I plugged in, one of the first conferences I went to was telehealth to connect and make sure people understood that this solution was out there. So either through a mobile vehicle or through care teams, that are driving site to site to care for patients, this is a solution that helps with that. And then with nonprofits, so just understanding that this is a low cost solution, the opportunity is here to connect folks and make sure that as a nonprofit, they don't have to take on that expense that they would have. So keep field-based staff connected with mobile access. One of the things that we're finding with soup kitchens and other community orgs is it helps them connect and collect money if they're out in the field and looking for donations. They can create a backup internet service. So battery backup solutions that we offer, you can have those on hand and especially keep them charged during storms and critical times, disaster. We also donate to disaster relief efforts too, and become a hotspot for free internet access for your community in your health center. And again, providing those devices to folks that might work at home or have flexible work hours, and then family-friendly policies. In the world of partnerships, I've selected Joe and the TechSoup team here to talk about the work that we do for nonprofits libraries. He'll do that. We also connect with Digital Wish, which is a schools-based organization. And then we have a regional technical partner that we work that provides some services in the local Rhode Island area. So they're a regional education network. You'll see our partnerships with them advancing. And essentially they help with more significant technical solutions. We're a partner with them. So Joe, I want you to talk about TechSoup if you're ready. Clear your throat and tell us a little bit more. Tell me when to advance slides.
Oh, I'm ready. Thank you so much, Brian. I appreciate it. All right, everybody. Now we're just going to talk a little bit about TechSoup, what we do, and the mobile beacon program within TechSoup. By a show of e-hands at the bottom of your screen, right next to the share button, there is a little hand pointed up like this. By a show of e-hands, can you guys go ahead and just click if you guys have heard of TechSoup before? I see Thomas. I only see the speakers, so if somebody can capture that information for me, that'd be great. Awesome. I see a couple of you guys raising your hands, so that's wonderful. TechSoup was founded in 1987 out of a need of technical services for nonprofits and libraries in the San Francisco area. TechSoup first started off as just an organization that was serving the United States, but we grew, excuse me, where we're now delivering impact to over 234 countries and territories worldwide. And we all do that with TechSoup's mission. And TechSoup's mission is to build a dynamic bridge that leverages technology and enables connections and innovative solutions for a more equitable planet. Next slide, please. So how do we do this? So, well, we have four pillars that we focus on. The first pillar being the software. So software that could be partnering with organizations like Microsoft, Adobe, and beyond. And those can come in a donation form, and those can also come at a deeply discounted price to the nonprofits and also to libraries. Now, one thing I just want to take a step back here. When I say nonprofits, that also includes healthcare industries as well. We have many healthcare members within our database, but the only thing is that they need to be a 501c3 nonprofit to take advantage of these deeply discounted offerings through TechSoup. So if your branch or your chapter is an identified 501c3 nonprofit, you can definitely take care of TechSoup's offerings. So we talked about software. The other pillar is services. And that could be, what we've come to find out is that that's for organizations that do not have an IT or a technical team. And these services can be help desk, Office 365 migrations, digital marketing, and beyond. Another pillar is resources. To our members, we offer webinars, blogs, and just trying to keep our community, our nonprofit and library community, just up to speed with all the new technologies that's coming out. So we invite professionals to come in and speak. We invite peers to come and speak about their experiences with the different product offerings, what have you. And it just sometimes I feel like knowledge is power, and sharing that knowledge within our membership base, it's super powerful. We just got to continue doing stuff like that. And last but not least, and this is the team that I'm on, which is the hardware team. And we offer both discounts and also donation programs within this hardware program. We partner with such organizations like Cisco, Dell, Lenovo, and of course, Mobile Beacon. Next slide, please.
Great. Just before I move on, so for the healthcare folks that are
Sure.
plugged in here, especially for small and medium-sized organizations, when I ran a smaller organization, having a TechSoup-like partner, know that they're a trusted organization that's supplying these services is really valuable to me. I knew that I could connect with them for resources and services, and it's a great value. So if you don't know about them, connect with them.
Thank you, Brian. Appreciate that. To TechSoup. TechSoup, we've been in partnership with Mobile Beacon since 2012. We have served $8.7 million in retail value, fair market value, to the nonprofit and library sectors, which translates to 96,000 codes. And you can say codes or devices, but basically 96,000 devices have been requested through TechSoup to distribute to libraries and nonprofits in the United States.
Eileen loves
Now,
you, by the way.
and these down here, so the schools, libraries, colleges, cultural organizations, and others, those were our top buckets of org types that had requested Mobile Beacon through TechSoup. We're hoping to get healthcare up there now that we have a 5G offering available. I think that the new speeds, speak volumes to a healthcare professional, especially when you need to download data or pull up a patient's records. Like the speed it will definitely help you complete your job to that higher level.
For the
Brian,
healthcare members, I'm remembering when iPads first came on the scene, and it was a big deal, and organizations wanted and didn't want them, and vetted them and didn't use them. I see tablets with such a prevalence in the field right now, especially using EMRs for data capture. And TechSoup actually has an Android tablet that's available with us in partnership that's crazy cheap. That includes 1 year broadband service too. So.
Thank you.
Yeah.
Next slide. So let's go ahead and talk a little bit about the partnership between Mobile Beacon and TechSoup. So who it helps? It helps all qualifying 501c3 nonprofits and libraries. How it helps in addition to the administrative fee, which pays for the device, there is a $10 a month annual charge for internet service, which is great. We cannot get that. As a consumer, we can't find that price anywhere. So I mean, it's just a steal of a deal, and we offer this to all of our members. So qualified organizations can receive all of the following. They can receive up to 11 donated 4G mobile hotspots. They can receive up to 11 discounted 5G mobile hotspots. And the newest addition was up to 5 discounted 4G tablets. These tablets, they're a little on the simpler side, they don't have too much functionality. But what's really cool about this tablet is that it can also serve as a hotspot as well. So if you're running 1 to 2 applications on a tablet and you also need a 4G internet hotspot, this tablet would be great for you. Next slide, please.
Oh, bulk orders.
Which one?
Bulk orders. Sorry.
Thank you so much. Oh, no, this is great. And last thing that I want to mention is, so yes, bulk orders. So we do have bulk ordering options available. One thing about the Mobile Beacon ordering process is that you would place the order on TechSoup, you pay for the device, which would then give you a discount code. Then you would go to Mobile Beacon's website, and then you would sign up for the service, pay for the service, and then also pay for the shipping and handling. With our bulk order, if you have a purchasing department that purchases products for multiple chapters, multiple 501c3 nonprofits, this might be the best way for you to go, because it's basically a white glove service. We take your order just like we do a little order taking. Once we receive your order, we'll go ahead and do all the back end work to getting those devices registered and set up and then shipped to your organization. And that is a program that both Mobile Beacon and TechSoup have both come together just to kind of alleviate the time that it would take to activate 55 devices.
And for the folks from the healthcare world, I think about, when my mother had cancer and I would take her in and she would have to complete these surveys while she was in the office and they would give her a tablet. So these are great tools for that. If you need 10 or 15 tablets for your organizations for a check-in process or a survey process, they really work well for that. Thank you.
Thank you.
Yep. So Joe, talk about the product offering.
All right. So these are the 4 product offerings that we have. The first one is a 4G internet service for nonprofits. And basically, the cost of this device is $18. It's super affordable. And on top of that 18, you're going to pay $120 for the annual service. So that's 12 months of internet service with T-Mobile. And then you would also pay for the shipping and handling as well. Okay. Now for the discounted product, which is the 5G internet hotspot, that one is at a discounted price, same as the donated 4G. You would pay the 155 administrative fee. That's the cost of the device to TechSoup, and then you would also sign up. Then you would go to Mobile Beacon's website and you'd pay for the 12 months of service and also the shipping and handling. And then last but not least is the tablet there. And this screenshot is actually straight from our website. So if you did go to our website and you did click devices and Mobile Beacon, this would come up. Or even if you search Mobile Beacon, this would come up.
Yep. And
Okay.
folks on the line, so if you think about these hotspots specifically, what I found care teams actually in the Western USA do is they're in vans of 3 or 4 people going from location to location. So if it's taking you a half hour to an hour or so for a group to get from location to location, that hotspot can be on. And if you're 4 people in a van, 3 are working, and 1 is driving through that process. So it's a really productivity booster. And also, I think the difference between the 4 and the 5G is probably the number of connected units that easily will facilitate work. So when you ask yourself which one is better, the 18 or the 155, the 155 is going to be more powerful for you to connect more people simultaneously and also do more data crunching, higher power streaming, that kind of thing.
But to put into that, the 4G covers anything you really need the internet to do. The 4G works well for that. Zoom calls, it can stream Netflix, whatever you want to do. Like Brian said, the 5G, really, like if you had a household doing that, that's the big advantage. Whereas the 4G, it's like, if you're 1 or 2 of you are doing some streaming and heavy data use, that kind of maxes it out. If you're just doing web browsing and stuff like that, you can have 15 people doing that. But once you start getting to the heavy duty data usage, that's where the 5G really has advantage of.
Yep. And I know one of the questions I got not too long ago was 4G considered high-speed internet access, and it is. So when you look up high-speed internet access, 4G is absolutely included. Personally, I didn't even think about this until about a year and a half ago. I upgraded my home internet service, which has about 50 things connected. I was on 1G service from 8 years ago, doing just fine, even streaming movies and that. So as we look to this 4G and 5G, it's really a significant advancement, and folks will be fine, especially households. So Tom, can you tell us a little bit about Digital Wish, since they're not present here?
Sure. So it's similar to TechSoup. We have a partnership with Digital Wish that handles the education side of things. Similar program to TechSoup. Costs for the service for the year is $120, same as it is for everything that we sell. And it's similar to TechSoup. You purchase codes through them, and they will provide you an email with the codes that you would then order through our website. But yeah, the biggest difference really between the two is that they handle strictly only education. So K through 12, public and private schools, and not and charters and stuff like that.
Yeah. And just thinking about it, as I realize I'm remiss in the healthcare world of providing an example of organizations. In the case of Rhode Island, locally, we have the Community Action Program in Rhode Island, Coventry Community Action Program using this for homelessness, for domestic violence patient, and for back to work efforts. So those are kind of some healthcare examples in which this is used explicitly. And kind of, I wanted to round this up with a quote for you that I really appreciated. So this was from the New York City Department of Education Pathways to Graduation program, and they provided that my mobile beacon hotspot was a game changer for me and my students. It truly was life-changing. The school did not have reliable Wi-Fi for their laptops, so it was difficult for them to do any research. Once they had the hotspot, they were able to connect your devices to their students and develop the skills they needed in college and careers. The possibilities are endless. So if we extrapolate that into the healthcare community, providing community members and patients to getting access to internet for education, for emergency services, for remote patient monitoring, and then for organizations for remote patient access and facility connectivity. That's really what this is about. When you boil it down, it's affordable internet connectivity through our partners to nonprofit schools and libraries. Also, some government institutions are eligible to connect as well, and of course, those healthcare orgs that are nonprofit.
And Brian, one of the last things I wanted to add that we don't advertise yet, but some of you may be thinking if you have devices already that you're paying an exorbitant amount of fees to, we are in the process of creating what we call a BYOD, bring your own device program. So if you do have tablets that are network capable, as long as they're compatible with the T-Mobile network, and we can do all that internally to check for you. We can turn service on that device as well. So a lot of you may have some devices that may be sitting in a drawer, or you're, like I said, you're paying a huge monthly bill, probably equivalent to what ours is for the year. You can work with us as well with that.
Great comment. BYOD coming on the way. So Nancy, if there are any questions that popped up through the thing, we're happy to take them, or for the folks on the call, we're happy to take questions for myself, Tom, or Joe.
Yes, thank you all, Brian, Tom, and Joe, for taking the time to give that really comprehensive presentation. I hope it was really useful for all of our attendees. I did see a couple of questions come through in the chat. I'm going to start with Bob Hunt, who's my partner at Fort Drum Regional Health Planning Organization and is our fiber expert and tech guy. Bob, I'm going to turn it over to you if you just want to unmute and ask your questions directly.
Sure. So you said it'd be about 3 to 5 years to completely roll out 5G coverage. I know I have the T-Mobile home internet service in Canton, New York. It's not eligible for unlimited internet access because it's not close enough to a cell tower to be eligible for that service. So you're saying 3 to 5 years to roll that out so we get better coverage. At about the time T-Mobile finishes doing that rollout, they're going to begin nationwide rollout of 6G. And what do you think? 8, 10, 12 years before we see that?
Before you see 6G. So if you have T-Mobile coverage now, it'll work. The 5G, they're building it as we speak. And the one advantage of the investment that they've done is if you get into the techie side of things, is what they call the sub-6. That has the more expansive coverage zones where you can plug a tower and it covers more. So you may see it even before then. But ideally, when a new technology comes out, currently what we're on, 4G and 5G, you'll see a transition to the newer, which is now it's 5G. That generally takes about 5 to 10 years to where 4G will start to be kind of phased out and eventually turned off. So we're way speaking way advanced. So 6G, like you said, maybe starting to come out 5 to 10 years. That's a whole nother conversation, and I don't even know what 6G is going to look like yet. What type of speeds we're looking at, but if you're in a more rural area, ideally, I would say that, I mean, you can never guarantee, but you're going to start to see more improvements yearly. Just depends on where they tend to focus at.
All right. So if I understood what you just said, if I'm in an area right now that's capable of getting a T-Mobile home internet service, which is limited at 100 gig per month, under this program, that would change to an
You'll still have access. Yeah, if you've got the T-Mobile access there now, You would
Right.
still have access with us, only it would be a lot cheaper.
And it would change from from a capped service to an unlimited service. Is that what you're saying?
It would be unlimited. They do put a caveat in there of 100 gig if the network is constrained, which they do that for all their service. And that just means like if you're in a heavy use area, the way I describe it's like if you're at like a baseball game and you're having a hard time texting somebody or getting an Uber or getting online, that's when the network is constrained. And if you've used your allotment of 100, they can start to deprioritize those people. But we have libraries that I look at their usage reports. They use people use their hotspots well over 300 to 500 gigs a month, and they have no complaints.
Okay, thank you.
Bob, I also hear it's partially demand based. So if you go on and click that you're looking to see if there's service, quite often you might change the demand curve and they might look a little bit closer at your area.
So every day that I'm doing it, probably not enough, you're saying, huh?
It might be enough.
I'll keep that in mind. Thank you.
Yeah, you're welcome.
Thanks, Bob. No other questions in the chat just yet. One comment from Aileen who said we love TechSoup, so shout out to TechSoup. And then I do see, Dave, your hand is currently raised, so if you want to unmute and share anything, feel free to do that now. But it also might have been before when we were all raising our hand about knowing TechSoup. And we had about 5 altogether that were aware of TechSoup as an organization.
Very good. I can tell you while you wait for questions from the Mobile Beacon side, like I said, I've got, 25 years in healthcare, 10 in healthcare reform. So connecting this to digital equity and understanding the overlay. One of the things that I'm seeing nationally is folks, as ACPN did, that was a direct to consumer initiative where consumers were getting a discount and various types of organizations were helping them get through that process. This shifts that to organizations really taking on the financial burden, as we know. But understandably, the big win in that case is we really in us being B2B, we really let you define who you give the solutions out to. So it's not an onerous process for your team to decide who receives and uses the services on your end. You don't have to provide paperwork of other social services or do that legwork for state or federal documents. So really we contract with the organization, you, and then you distribute them at will to whoever you feel appropriate, be it a worker, be it your facility, or be it a community member or patient that is most needing of the solutions.
Got it. Thank you. And oh, Aileen, I do see your hand raised, so I'm going to invite you to unmute as well.
Listening to your presentation, the assumption is that we're going to get these devices back. Is that the assumption?
I think that's up to you, really.
Okay.
So some organizations do lending programs and hospital. It's typical that organizations do lend them out in, let's say, a month cycle or a 2-week cycle, but that's really up to you on how you want to administer them. You could lend them out indefinitely,
Yeah, they can. The hotspots are fairly simple in regards to a mobile device. They're a lot less like your phone that could have software that could get corrupted by an app. The hotspots, as long as it's physically okay, they could last for 5 to 10 years, as long as the battery is good. So realistically, if somebody doesn't have access, you could keep renewing every year if they wanted to.
In the nonprofit world, I'm finding alliances, nonprofit alliances and associations creating programs to say this is an offering. And of course, those organizations that, use the organization, you just buy the router and it's yours and it's not a lend.
Thank you. Yeah, we found it was a barrier to lending any equipment during COVID because people were afraid that they would have to pay for it if it got destroyed or whatever. So we just found some of the cheapest equipment we could find and with thanks to TechSoup. And Gage just gave it away.
Exactly. I was going to say that's one of the wins with the TechSoup partner is that 4G device is a crazy good price and it's minimal loss to the organization if you don't get it back.
And a lot of libraries will put in a rider or an agreement, just like anything else, that there could be a cost if they were to break it or lose it. I've talked to some libraries. Some libraries say they don't they don't fulfill that agreement. They just kind of put that as like, hey, just so you know, this could happen, and that could be kind of like a CYA type of thing to kind of recoup that cost if you wanted to go that route.
I'm finding also, we have several partners that get hundreds and thousands of these, and they do really significant size programs. So in my experience, they're more monitoring that they have these out, that they're being used, and I think the expectation to get them back is less for sure.
And I'm really glad you guys brought that up because I know a lot of limiting factors. If someone, from an organization that purchases stuff routinely from TechSoup is, you always got to be very mindful of the terms and conditions. And I know a lot of those products you have to use strictly, for your organization where, as a nonprofit, if there is a strategic partnership that you were working with somebody in, and maybe they were a 501c4, for example, that equipment had to stay within your organization and couldn't benefit anything else. So I'm really glad you guys brought that up because that is, from what I've personally seen, is a little bit more unique to some of the partners that are on TechSoup. Is you guys, your terms are definitely very open as long as it's benefiting, a need, for your organizations. We can get these out kind of outside of our own four doors. So I'm really glad you guys brought that up and made that available to us.
Yeah, the only thing we don't allow is for you to resell it. So you can't create Nancy's wireless broadband company and start selling it for $20 a month. That's really the only big no-no that we have.
One of the things I don't think we mentioned through this process is as you start to think about broad communities accessing this, I omitted it from our presentation. Our solution does afford you the opportunity to implement the SIPA filtering, so the Children's Information Protection Act, and limit the data that's being seen. So if you're an organization that really wants to understand a little bit better or make sure that there isn't objectionable websites being accessed to the end user, if it's you as an organization lending to your employees or just an organization you don't want people to have access to, maybe there are children in a household that you want to make sure, you can implement the SIPA filter.
Yeah, a lot of times too, federal funding requires that, as the government kind of wants to make sure that the stuff isn't being used for ulterior purposes. So that we have that capabilities of turning that on from the get-go or even after the fact. It's a lot easier to do it before, but yeah, we can also do it after.
Thank you. And yeah, Aileen did mention in the chat that she said, we count our consumers as, in quotes, within our organization and continue to work with them. And their only requirement was that the consumers had to accept coaching from them on how to use the devices for telehealth. And some of you may remember that last year, maybe 2 years ago now, Aileen did a presentation on the program at NERCL where they were sharing Chromebooks with their clients at NERCL, which is great.
That's a really good point too. So as we work with digital equity partners, we're finding, especially for those organizations that are going to order hundreds or thousands, a key piece of the success of that, of course, if you boil it down, the bottom line is somebody getting access where they didn't and using where they didn't have that before. So ensuring that you have resources to unbox several hundred of them, turn them on, put the SIM card in, and then ensuring that there's a training protocol in place, either active or passive, for your consumers that are using this so that they understand the setup of their device the first time and connecting their other devices to it and with actually ability to use. So that's a really key part of anybody who's doing a larger program, ensuring that you have resources to help you out with that.
Thank you. Yeah, that's a great point. So I'll leave the chat open for another couple of minutes. I just want to again say thank you to Brian, Tom, and Joe for joining us today. I think this is a really great conversation and really great information for a lot of our partners throughout the region and beyond in New York. And as a reminder, we'll be following up with the notes and the recording, as well as the slide deck, which has all of Brian, Tom, and Joe's email addresses in there in case you're interested in reaching out and chatting a little bit more with them directly. If you had any questions, you could always feel free to email me as well. The notes document will have a few additional reminders, resources, opportunities. As a reminder, our annual conference, North Country Leadership Summit, is coming up in October 9th and 10th up in Lake Placid. We still have sponsorship open. We did close our call for presenters. We're cleaning up and locking down our agenda currently, but it is shaping up to be a really exciting agenda with a lot of really great partners and speakers that we're excited to share soon, hopefully. And we also are still accepting nominations for our Telehealth Innovator Awards. We like to celebrate regional partners that are increasing access to healthcare via telehealth. So if you have any partners that you want to highlight and celebrate, please feel free to submit a nomination, and that will be in the notes document as well with all the information about that. And then just finally, a few really great opportunities virtually coming up tomorrow. HRSA is hosting their national virtual telehealth conference, and I'm going to put the link to register for that right in the chat since it is coming up tomorrow, and I want you to be able to register ASAP if you are interested. But that'll be a full day event with a few different good sessions that the federal HRSA partners are hosting. So that will be really a nice upcoming opportunity tomorrow. In addition, the National Telehealth Resource Center is having a webinar coming up, Priority Setting in Digital Health. There's a New York Health Foundation expanding equitable access in telehealth across New York State policy recommendations webinar coming up on the 25th. And then our partners over at Netric, the Northeast Telehealth Resource Center, their annual conference will be happening September 16th through 18th in Nashua, New Hampshire. So a lot of really great opportunities coming up. That'll all be in the notes document in case you're looking to get some more information or register for any of those events. And with that, we'll close it out. We did reach the top of the hour. I'm happy that there was some really great conversation after the presentation with our partners. So thank you again to Brian, Tom, and Joe, and to all of our attendees for joining us this afternoon.
Thank you so much. Appreciate it. Pleasure meeting everyone.
Have a good week.
Have a great rest of your day, everyone. Thank you so much.
Thanks.